Orthokeratology is that it's a procedure or therapy to design a special lens or gas permeable lens, material lens to wear them at night. So we gently reshape the surface of the cornea to reduce the nearsightedness or to eliminate. I was in glasses from like age about 8 years old, second graders, and my myopia really progressed very rapidly. So I was as high as about minus 850. When I was a student in Berkeley, in undergraduate, I used to wear hard contacts. And then being highly nearsighted, that I was very inspired by the work they did. So I really got into the optometry school thinking that I wanted to devote my professional time to help out the nearsighted children and adults, of course, and that was really, I felt like it was my mission. Currently, all we have is really about 4, I guess, alternatives or choices. The first, of course, glasses, right? It's for adults and children. Glasses are there. Second option will be contact lens and glasses, like soft lens. Millions of people wear them. And the third option will be orthokeratology. When we apply that to the children, we have 2 benefits. Not only that reducing the myopia, but also by doing a long term, will prevent or slow down the progression of myopia. And when we apply that to the adult who is already nearsighted, all we do is getting that effect of reduction of the myopia. And then fourth option would be surgery. But surgery is only for, I really will recommend the surgery only to an adult over 25. So for children, surgery is not an option. But we would like to, I like to add another option available for small children who is becoming rapidly nearsighted. There is an atropine therapy, which is actually an eye medication that we put on. And definitely it's been proven over and over, it slows down the progression of myopia, but it has a lot of side effects and complications. But so it's only applicable to the very small children. So that's another option though. So basically 4 options. Ortho-K is the best, but second best will be wearing a hard lenses during the day. And third option will be wearing glasses. Orthokeratology is really a skill of fitting of designing the lens. So I would assume that prefer to find a doctor with a lot of experience. Children's do change. They grow, and then eyeball size, shape, and changes as they grow. The nearsightedness increases. So if small children go through the Ortho-K and it works well for a year or so, and then the vision gets worse, then of course you gotta go to the doctor, and then vision could get worse, especially children. So need to be refitted. Parents' point of view, if you're looking for a doctor, I strongly recommend from the local place that where you are, you should go to the academy website. Try to find a doctor who at least spends their time and money and effort to go to the academy and be certified for the many different lenses, spend that time to learn. So there is it's an Orthokeratology Academy website is available, maintained. If you cannot just kind of fit it and it gets blurred and then just stops, then myopia will go right back to it and it's going to progress as the genetically determined. So you need that patience and continuously maintain. Probably done 5,000 plus cases, but I just like to add that orthokeratology has been known as a myopia controlling or reducing therapy. But now that with a seasoned practitioner like myself and some of my colleagues, we are actually trying to fit even non-myopic patients, like far-sighted people or far-sighted old vision person. It's called hyperopic presbyopes, that which means like who has a problem seeing far and then have more problem with the reading. As a 45 years old engineer that who has to have glasses for computer, glasses for reading, glasses for driving. those type of people. And also people who went through the LASIK or corneal surgery. And then now they're doing a lot of reading that myopia regresses. So even post-LASIK patients, that of course there's a limitation, but orthokeratology could be applied for those patients. I think within next 30 years or so, 20 years, and I think orthokeratology will be mainstream first choice procedure for small children who is becoming nearsighted. And so hopefully most of the price will go down, more doctors are well trained, and better procedure to make the corneal mold will come out. And so we should be able to apply to every single applicable children who is acquiring nearsightedness should be treated. And also there is a permanent orthokeratology will become available. In other words, that we gently mold the cornea non-surgically without cutting any part of the corneal tissue, that we should be able to mold it and let it stay so that you don't have to wear it every night.